My name is Molly and I'm the TCI nurse here at the Royal London Hospital in the Neurosciences department. Mainly I meet with all of the elective neurosurgery patients and I make sure that they are comfortable and they're prepped for surgery and they know who they need to meet on their day of surgery before they go down. So I ensure I've done their blood pressure and that I have checked their bloods, I've taken bloods, they have adequate intravenous access and generally they're dressed in a hospital gown with the relevant head stockings on and so that they're ready to go whenever the theatres might ring for them. So originally, as any nurse would, they do a bachelor's degree in adult nursing or child nursing or mental health nursing. And once you're finished then you go into any newly qualified job that you feel that you want to. I always knew that I wanted to do neurosurgery and coming to the Royal London was obviously the ideal way to do that. Whilst working at the Royal London, I previously worked in the neurosurgery high dependency unit that runs next door to here, and in there we deal with very poorly patients who have just come out of our ITU, often fresh out of surgery, mainly looking after people with brain tumours, neurovascular malformations such as aneurysms and AVMs, and neurotrauma. I think particularly with neurosurgery it is completely unpredictable and that the vast array of patients that you do get can sort of present in all different ways. Every patient's recovery is completely different. And on top of that, actually, the different recovery process for each patient, i.e. whether they need more cognitive rehab or physical rehab and how well they can recover from such catastrophic injuries is really quite amazing. So my nursing training I completed at St George's and Kingston University in South London. You go across all specialties, so as much as I probably would have loved to have stayed through neurosurgery throughout, I had placements in cardiac, renal, general surgery, ITU, A&E, and you just get an absolute wealth of experience whilst you're doing it, and you really do have to grab every opportunity that you can do. Whilst I was training, actually, I worked as a healthcare assistant throughout my training to help me financially, and also you're constantly learning, you're never not learning in that job, and it's huge for your career. It's a really big deal. I'd probably recommend all nurses to do that prior to becoming a nurse. I will always say that Kingston and St George's are the best. That's because I train there. But nursing training is 3 years. Depending on whether you decide to do a master's afterwards, that's completely up to you, but after the 3 years you are a qualified nurse and you will gain NMC registration providing that you finish the course. Once you finish there, there's unlimited continuing professional development courses that you can go on through your hospital. The Royal London and Barts Health itself is fantastic for funding that sort of thing. They really do invest in all of their employees. And I felt really supported when I first started here. It's probably what I like the most actually, is that constantly being, have you booked this course? Have you booked this course? And knowing that you've constantly got something, you've got your teeth into something all the time. I'd been here about 6 months before my manager offered me the high dependency course, which was unheard of and fantastic, but I thoroughly enjoyed that. And once finished that, I then was immediately seeking something else to do, constantly trying to be busy. And I think when you're working with other people like that, I think it inspires you constantly to be hungry for a new bit of education or a new qualification that you might be able to gain. So for me, I can't see myself moving from the Royal London very soon. I love working here at the neurosurgery department, and I think that all of the staff do too. You find that not a lot of people leave here, and I think that's a lovely place to work. For me personally, I feel that some sort of nurse specialist role, particularly within cerebrovascular disease, not pertaining to stroke but more to aneurysms and AVMs, which are arterial venous malformations within the brain, and dealing with those patients, they can be very long term and their recovery can be very slow, and I think dealing with them and meeting them regularly, meeting with their family would be a really lovely extension to the job that I do right now. I think when you are at school as a student, 17, 18 years old, if you appear to be very good at science and maths, many teachers and most sixth forms and parents would turn to you and think, are you thinking about medicine? And I think being a doctor is an outstanding and incredible superhero job, but I still don't think that because you are particularly clever, that actually medicine is the #1 job for you. And I know plenty of professionals in physiotherapy, occupational therapy, psychiatry that were equally as academic and still chose to not choose medicine and to choose a different avenue, whether it be allied health professionals, nursing, midwifery. For me personally, I was in that position and both my school and my family desperately wanted me to be a doctor. And despite that application, despite getting good grades, I still chose nursing. And I think having the confidence and the courage to do that and to choose exactly what you want to do, because they are completely different jobs. Don't get me wrong, you're working towards the same goal, and many of the attributes that you need to be a doctor, you will need to be a nurse. But having that 24-hour care, that constant contact, that real investment emotionally in a patient, I thoroughly enjoyed. And I think from even my first day as work experience shadowing intensive care nurses, I knew that was where I needed to be. And I think maybe that led me to think about nursing and wanting to succeed quickly and chase sort of further education in that subject as well.